That was the sun coming up, me cycling to work one day this week. That was nice, wasn't it? Hey, also, look at this. I'll show you one of these. Nothing to do with this week's topic at all, but been 3D printing some stuff for a buddy of mine. What's that? It's a bone. Which bone in the body is that? It goes. It goes with this one. Does that help? They're a bit bigger than normal, aren't they? Cool. I'm printing the ossicles of the ear. We're going to try and make a working model of it and that sort of thing. Anyway, nothing to do with this week's topic at all. This week, I wanted to talk about the muscles of the lateral neck. It's on my to-do list. I know that I've talked about a lot of neck stuff, but this is going to be a visual thing. We've looked at the strap muscles of the neck, and we've looked at the accessory, the muscles that are innervated by the accessory nerve. We've looked at even the scalenes on their own. But what I want to do is, when we're looking at something like this, there's an awful lot in there, right? And it can be very confusing. So I want to just look at the lateral neck and see what we can see there. And I'll talk about the muscles, their innervation, attachments, but have a look for the other structures that are nearby relative to those muscles while we go, all right? Okay then, all right, I've got a lot of necks. I think we'll predominantly use this one. Oh, it doesn't show the muscle I'm looking for. So it's this muscle here, right? Oh, there we go. That's what we can see here. This is a very thin, very superficial muscle. It's just underneath the skin. You can see it's running from the fascia overlying pectoralis major and deltoid, and it's running over the clavicle, over all these structures of the neck that we've looked at before, over the mandible, and into the lower part of the face, the chin and the jaw. This is platysma. That's the most superficial muscle of the neck. I said we were looking at the lateral neck, right? So you can see it anteriorly there, and you can see how it's expanding laterally there, and you get an idea of the direction of the fibres and that sort of thing. Now, what does it do? Well, it moves the skin, and you can see the face I'm pulling when I do this. It's pulling down the corners of my mouth and making me look very unhappy. So it's a muscle of facial expression. So it's innervated by a cranial nerve 7. The facial nerve, cranial nerve 7, is the nerve that innervates the muscles of facial expression. Not the muscles of mastication that move the jaw, but the muscles of facial expression. They change the way your face looks. So platysma can also pull down the mandible. But that's the first one. So we're going to go from superficial to deep. So there's platysma. Take away platysma. What do we see? Well, we see this muscle here. This is a very pronounced muscle. This is sternocleidomastoid. So again, this is quite easy to palpate on yourself, particularly if you breathe in deeply. Because it's running from the mastoid process up here down to the sternum and the clavicle. So this is sternocleidomastoid. There's one on either side. They run at this interesting angle around the neck. So it's largely a muscle of the anterior neck, but it's clearly a muscle of the lateral neck because we can see it here. It's a major landmark. So, I mean, with the breathing in example, what you're doing there is you're elevating the rib cage so that you can breathe in maximally. So sternocleidomastoid can help with that. But what it really does is if it attaches to the mastoid process and it attaches to the sternum and the head of the clavicle, you shorten the muscle on one side, it's going to do that, right? It's going to bring your ear closer to your sternum. So really, it's because multiple muscles contribute to multiple movements. Sternocleidomastoid, you know, if they both work on both sides, then they help flex the neck. That's flexion anteriorly. That's the extension of the neck. And also they can help with lateral flexion and rotation of the cervical vertebrae, or rotation of the skull on top of the cranial vertebrae, the cervical vertebrae. I have to watch out for me talking gibberish because I'm really busy and my brain works faster when I'm busy, and my brain works faster than my mouth. Sternocleidomastoid is innervated by the accessory nerve, cranial nerve 11. And the other muscle that's innervated by that same nerve is trapezius. So trapezius is largely a muscle of the back. We talk about upper fibers, middle fibers and lower fibers. And trapezius is running from, we've got this nuchal ligament here, we've got the occipital bone here. So these fibers are spreading from those sites across to the scapula here. The trapezius it's a whole other talk. It's a whole other video. But that's what we can see here. So if again we go back to the lateral neck, we can see sternocleidomastoid and we can see trapezius here laterally. So this is it's the posterior border of the posterior triangle of the neck. So it's posterior part of the lateral neck, but it's also fairly superficial. So we'd have to take off sternocleidomastoid and trapezius to see the deeper muscles. And trapezius is also innervated by the accessory nerve, cranial nerve 11. Okay, what it does is it elevates the scapula, so shrugging your shoulders. It's also involved in transferring load to your upper limbs through deltoid and so on, all right? But like I say, there's a lot more to talk about there. So those, I say, were the easy ones. Platysma, sternocleidomastoid, trapezius, taking them away. Okay, the other side has taken them away, but we can see this muscle here. What's this muscle here? It's a little strap muscle, and it's one of the strap muscles of the neck. This is the inferior belly of Omohyoid. So certainly when I was studying anatomy and dissecting, this is one of those things that would trip me up. It's like, feeling confident and then, oh, what's that? So omohyoid, omos refers to the shoulder, so we're thinking scapula again. Hyoid refers to the hyoid bone up here. So the omohyoid muscle is a strap muscle that runs at this funny angle across the neck here, and it's held down by some connective tissue deep to sternocleidomastoid, where it changes angle and runs up to the hyoid bone. So the omohyoid muscle. It's innervated by ansa cervicalis, this loop of nerves that forms from the spinal nerves at the cervical level. So it's innervated by fibers from C1, C2, C3. Of course, it's a little muscle. Upper limb's a big thing, so it's not going to have a noticeable effect on the shoulder, but the hyoid bone is a small bone, so it can depress the hyoid bone. I think generally we'd consider that's its main action, is it depresses the hyoid bone. So that's omohyoid. So okay, take those off, take off omohyoid. All right, you're going to have to transpose yourself now. We're looking the other way. All right? So did you notice some structures as we were going? Like these two arteries here, artery and vein, these two blood vessels here. We can see some blood vessels there. Right, what can we see now we've taken the muscles that we've talked about off? Should I put now we're in business. So this artery here, that's the subclavian artery, and that's the subclavian vein there. So notice, if we consider these three muscles, 1, 2, 3, the subclavian artery is passing between these two muscles, but the subclavian vein is not. These three muscles here are the scalenes because they're making this scalene triangle shape. And the scalene muscles are running from the cervical vertebrae, from the transverse processes, the bony bits that are sticking out of the side, to the first rib and the second rib. So that means that the scalene muscles on either side could take part in lateral flexion. It's not a great shot. So the scalenes on that side can laterally flex the cervical vertebrae, and the scalene muscles on that side can laterally flex the other way. And also because they're attached to the ribs, again, there's that deep breathing thing. So if you breathe in deeply, you can feel sternocleidomastoid, and if you palpate where the scalene muscles are and you breathe in deeply, you can feel, you can feel that those are contracting as well, because they can also elevate the first and second ribs and pull the ribs up and help with inspiration. So we have scalene, well, they've got a couple of names as usual. The easiest way is the anterior scalene muscle, middle scalene muscle, and the posterior scalene muscle. And we do have some other muscles here which can confuse identifying the scalene muscles. The scalenes also get called scalenus, so you can also call them scalenus anterior, scalenus medius, and scalenus posterior. So then the subclavian artery pops out from between the anterior and middle scalene muscles, and in fact the brachial plexus also comes out from that gap there. The first two, so the anterior and middle scalene muscles, pass to the first rib, which is what we can see here. This muscle overlying it is covering that up a little bit. So they're passing to the first rib, either side of the subclavian artery, whereas the scalenus posterior muscle is running to the second rib. The anterior scalene muscle is coming from from the transverse processes of cervical vertebrae C3, 4, 5 and 6. The middle scalene muscle is coming from the transverse processes of cervical vertebrae C2, 3, 4, 5, 6 and 7, and the posterior is coming from 5, 6 and 7. But how useful that is, I don't know. I mean, it's not, I have to go and look it up. It's not the sort of information I carry around in my head. But you get the idea that it comes from the cervical vertebrae and runs down to the first and second rib. That's the important bit, right? The scalenes are innervated by spinal nerves from the cervical level, not really surprising that. So I might even say the anterior rami, that is the anterior branch, because there is a posterior branch of each spinal nerve as well. Because I'm going to mention the posterior ones later. But the anterior rami of spinal nerves C4, 5 and 6 send branches to innervate the scalene muscles, and they receive their blood supply from branches of the inferior thyroid artery, generally speaking, which is in itself arising from the subclavian artery, but there's a bit of a route, and again we're going off topic, aren't we? Okay, so the scalene muscles. So what you want to do here is you want to look, that this is the internal jugular vein we can see here. If I take that off, we can see the common carotid artery, and it's dividing up here into external and internal carotid arteries. So these are structures we can see next to those muscles, right? So to identify, what you want to do is you want to identify, after you've taken off sternocleidomastoid, the anterior scalene muscle, and then you can go anterior, middle and posterior. And posterior is overlapped by this muscle, so don't get confused. Don't go thinking this is posterior scalene, because it's not. It is also running from transverse processes of cervical vertebrae, but if we see where it runs, it's not running to a rib, it's running to the scapula. So this is the medial and superior part of the scapula here. So this muscle running to the scapula is levator scapulae, suggesting that it's a muscle that can elevate the scapula, and it can. There are lots of muscles attached to the scapula, and the scapula rotates to give rise to a wider range of movements of the upper limb. So levator scapulae can take part in rotation of the scapula, in elevating the scapula, and like the other muscles attached to the scapula, it can stabilize the scapula while other things happen, all right? It can also, because you've got one on either side, if you contract them both at the same time, it will extend the neck, right? You can see, look, it's really high up in the neck, right? So it's coming from transverse processes of cervical vertebrae C1, 2, 3 and 4. And that's why when we look at these transverse processes, we can kind of see a couple of lumps. We can see attachments for muscles anteriorly on the transverse process and posteriorly on the transverse process. Do you know what I'm talking about, right? It's these are the transverse processes here, and they're not very impressive, are they? In the neck, they're not very big. And these are the spinous processes. So we can see there's like a couple of lumpy bits. Wherever we see a lumpy bit, that's where a muscle attaches, because it affects the bone. So this is what I mean by the transverse processes here. Innervation of levator scapulae is from C345 and the dorsal scapular nerve. Oh, same as the diaphragm. Again, do you need to remember that? Levator scapulae. Okay, so those are the deep muscles of the lateral neck here. If we consider the scalenes then, what would happen if the anterior and middle scalenes increased in size through hypertrophy? What would happen here, right? So as these muscles get bigger, the gap between the muscles is going to get smaller, and you can see the subclavian artery here, so that could be compressed and could affect blood flow to the limb. So the subclavian artery is going to the upper limb, but also the brachial plexus, a great big set of nerves is coming through that gap and going to the upper limb, so it could affect the nerves running to the upper limb, giving all sorts of things like paresthesia and what have you. So the scalene muscles are an important landmark for these things, but also they can affect structures running to the upper limb from the neck. One more muscle left. Okay, so we're looking at the lateral neck. I can see another muscle here in the lateral neck. Stunk. This here. This is a muscle of the back. It's a deep muscle of the back. But look, it's coming around laterally. So if you're looking at the lateral neck, and our aim today is to visually look at these things and identify stuff, we need to identify it. That is Splenius capitis. The word Splenius refers to a bandage, wrapping something up in a bandage. You can see how this muscle is it's wrapping over the muscles of the deep back or deep neck like a bandage. And this one is going to the head, the caput, so Splenius capitis. And it's a muscle of the deep back, but it's in the lateral neck there. So we can see it's attached to the mastoid process, and it's attached to the occipital bone here. And it's coming from, a bit like trapezius, it's coming from the nuchal ligament and the spinous processes of cervical vertebrae down here. So, I mean, look as well, Splenius capitis, don't get confused with trapezius. Here's trapezius. We have to take trapezius off to see Splenius capitis. We can see a bit of it here, right? But Splenius capitis is deep to trapezius, so don't get confused by that. It is innervated by the posterior rami of the spinal nerves at the C3 and C4 levels. So the spinal nerve comes out of the spinal cord, gives off a posterior ramus, ramus just means branch, anterior and an anterior ramus. And the anterior ramus is the interesting one that disappears off around the body, and we give it lots of other names. The posterior rami, they just go to these very deep muscles of the back, like Splenius capitis. So a little bit of extra thing, but it's kind of cool. Right, it's a big muscle, so its main job then, if you use them on both sides, is extension of the neck. So particularly if you lead forward, right, against gravity, these are quite good at extending the neck. Trapezius does that. It's like whenever you make any movement, lots of muscles are working together and have got to relax to stabilize things and move things and that sort of thing. But it's, it extends the neck, and because it runs around to the side, it can also take part in lateral flexion, right? Lateral flexion of the neck. Splenius capitis can also aid in rotation of the cervical vertebrae and the head atop the cervical vertebrae. So there's a lot of muscles in the neck. Okay, that's it. When you teach anatomy, you kind of do chunks, and at some point you want to fill in the gaps. This is kind of a fill in the gap thing in an overview. So we had a visual look at the lateral, or the muscles of the lateral neck working from superficial to deep. And we saw where they were and how to identify them. I think we can pretty easily work out their actions now. We talked a little bit about their innervation. It's usually a spinal nerve from the cervical level. And Robert's your father's brother. All right, So that's it. See you next week.